Hey guys, today we will be discussing strokes. In the United States, someone has a stroke every 40 seconds, and every 4 minutes, someone dies of a stroke. By the time we finish this video, roughly 11 people will have had a stroke, and 1 to 2 people will have died from a stroke. So, what is a stroke? By definition, it is the sudden death of brain tissue that occurs when blood supply is interrupted or reduced by a blockage or bleeding in the brain. The brain is surrounded by lots of arteries and veins that nourish nearby brain cells with oxygen-rich blood and nutrients. You can think of blood arteries and veins like a garden hose. If there are no obstructions within the hose or no holes within the hose, then the water can flow through freely. Obstructions in the brain, such as fat, blood clots, or even air bubbles in the vessels, can cause a buildup of pressure and clog, therefore causing a stroke.
Next, we are going to talk about the 3 common types of strokes. The first and most common stroke is called an ischemic stroke, which is where blood flow to the brain is interrupted by a clot or narrowing of the artery. And a clot can be made out of different things, such as blood, as is what we see here, fat, and even a dislodged air bubble. An example of an obstruction provided is an artery that is progressively getting clogged with adipose, or fat buildup, which described as a disease called atherosclerosis. The further blockage there is to a blood vessel, the more damage to the area the blood vessel is nourishing to, because the blood contains oxygen and nutrients that it needs to survive, such as what we see here. A second type is called a transient ischemic attack, or TIA for short, and it's a medical emergency that has similar mechanisms as a stroke, but here, blood flow is temporarily blocked and often resolve on its own. Thus, symptoms of TIA do not last as long as a stroke because there is still presence of a little blood flow. After a TIA, individuals will have a 25% greater risk of having a stroke and other serious complications within 90 days. That can be really scary stuff. And lastly, a hemorrhagic stroke, which is where an artery ruptures and leaks into the brain, causing brain cell death because of the pressure of the surrounding tissues. So if there's an increase in blood volume with the rupture, this will also increase pressure in the brain. The blood would pool into the surrounding tissue rather than the tissues that it needs to be, which means artery cannot oxygenate the blood cells that it supplies to properly and affect brain function, as we see here. You may hear the word anoxia, which is a word meaning a complete lack of oxygen to a region. Overall, there are different subcategories of a hemorrhagic stroke depending on where the bleeding occurs, but the most deadly type and what we see here is called an intercerebral hemorrhage.
Next, we're going to talk about the symptoms of stroke. A person experiencing a stroke would have to respond fast. The Be Fast acronym helps people identify the symptoms of stroke. B stands for balance. Does the person have a sudden loss of balance? E stands for eyes. Has the person lost vision in one eye or both eyes? F, face drooping. Does one side of the face droop or is it numb? Ask the person to smile. If the person's smile is uneven, they may be suffering from a stroke. A, arm weakness. Is one arm weak or numb? Ask the person to raise both arms. Does one arm drift downward? If so, the person may be suffering from a stroke. S is for speech difficulty. Is the speech slurred? And T, time to call 911. As the acronym states, be fast. Time is of the utmost importance to get the person suffering from a stroke to a hospital immediately. Other symptoms of a stroke include numbness, confusion, trouble seeing, trouble walking, and severe headache.
There are a variety of conditions that can increase one's risk of stroke. Risk factors include older age, family history, high blood pressure or cholesterol, diabetes, smoking, and obesity. It's also known that stroke is more common in men than in women, but more than half of total stroke deaths occur in women. The faster the intervention occurs, the higher chance for a better outcome or recovery. For an ischemic stroke, doctors focus on returning blood flow to the brain. Doctors can use intravenous thrombolytics, also known as clot busters, to break up the blockage seen in this video. These are the most effective within 4.5 hours from the start of symptoms. IV injection of a recombinant tissue activator called Activase is the golden standard treatment. Alternatively, endovascular procedures are sometimes used for more serious ischemic strokes. Under sedation, a long, thin catheter is inserted, through an artery in the groin to the brain to deliver activase directly to the brain. This can be done after the 4.5-hour mark. Similarly, patients can undergo a thrombectomy, in which surgeons use a device attached to a catheter to directly remove clot from a blood vessel. This is most helpful for people with larger clots that can't completely dissolve with clot busters. On the other hand, treatment for hemorrhagic strokes focuses on controlling bleeding and relieving pressure in the brain. In a hospital, patients must be given drugs or transfusions to decrease the pressure in your brain. If the area of bleeding is large, surgery is then performed to remove the blood, relieve pressure on the brain, and repair damage done to the blood vessels. Patients can have a clamp placed at the base of the aneurysm, seen here, to stop blood flow to it, which prevents the aneurysm from bursting and keeping it from bleeding again.
Rapid fire to conclude. Today we learned that strokes are a sudden death of brain tissue that occurs when blood supply is interrupted or reduced by a blockage or bleeding. The most common stroke is an ischemic stroke, that is a blockage caused by the progressive buildup in the arteries or clot in the brain. The other type of major stroke is a hemorrhagic stroke, which is when blood vessels such as an artery ruptures and leaks in the brain. As blood pools increase, pressure on the brain accelerates cellular death. To remember the common symptoms of a stroke, think fast: facial drooping, arm weakness, slurred speech. It's time to call 911. Risk factors include older age, family history, high cholesterol, smoking, obesity, and prior transient ischemic attacks. Lastly, interventions for ischemic stroke include clot evacuation via surgery and drugs. Interventions for hemorrhagic strokes include aneurysm clips and drugs to decrease pressure in the brain. Thanks for tuning in.